All right, so the National Health Insurance Bill being debated in Parliament and getting mixed reactions from various party contributors. For more reaction on the developments of this bill and the debate that's taking place, we now have in studio Anele Yawa, who is the General Secretary of the Treatment Action Campaign, a civil society organisation that campaigns for access to AIDS treatment. Thanks so much for joining us. Welcome to the programme.
Thanks, Bud.
All right, so the Health Minister talks about this bill, NHI, really dealing about helping those who are in need the most. So as TAC, are you happy with the NHI?
So thanks for having us here. One, I think we need to put it quite categorically clear that the bill still needs to go to communities. But ours is to focus on the key issues that the minister spoke about today, as to say, is the first step in terms of fixing the broken healthcare system. So we welcome the announcement of the minister on his statement today about the injection of resources, about 51 billion, and the hiring of nurses, doctors, community care workers. As much as we say it's not enough, but it's a good starting point moving forward.
All right, so we hear parties like the EFF saying that unless you build hospitals and infrastructure, all of this is just posturing and it's really not going to make a difference. The DA even saying that actually in its current form, it's a waste of money because the pilot programs have failed. What's been your experience?
So for us as TAC, and the majority of the public healthcare users, we are saying, according to the survey that was conducted by the Office of Health Standards Compliance 2016-2017, out of 696 clinics they surveyed in the country, only 5 clinics met 80% of the core norms and standards of health. So we are saying what is important now is to focus in these clinics and make sure that when the NHI is implemented, all our clinics or all these clinics are ready for the implementation of the NHI. But also in South Africa, we've got a population of 57 million plus. It is estimated that about 42 million people are public healthcare users. Then let's look at the healthcare workforce. Our healthcare workforce is less than 300,000, both in private and public. So one of the things that we are calling for is to say, Minister, let us unfreeze all the frozen posts in all provinces so that we can have more nurses, more doctors, more community care workers who will be able to work on the ground. So the announcement of about 10,697 new staff that is going to be hired by the department, it's a promise and a step moving forward. As much as we are saying it's not enough, but it promises that there is something that we are going to do. However, for us as TAC, we are going to monitor everything that the minister has promised the people of South Africa. It is against that reason that as TAC and other public healthcare users groups, we've got a draft MOU on how are we going to monitor our healthcare facilities as well as the healthcare system in general, so that we are able to go to clinics and identify the gaps and be able to advise the politicians and the government so that we ensure that there is quality of healthcare services, there is access to affordable and effective medicines for all.
All right, so TAC has been around for a long, long time now, and you've been already doing this role of lobbying, monitoring, and I just wonder, I mean, we're in this situation now, so how effective have you been going up to this, and will you be able to be more effective with the NHI, or are you going to face the same battles, the same challenges in trying to get the department and government to do the things that you've been crying for the last 20 years?
On the 9th of June, Tuesday, TA's leadership met in Parliament with the Minister of Health, the Deputy Minister and the DG, and we presented what are the issues that we think are a priority, things that should be attended to as a matter of urgency by the minister. So we hope that the minister is going to deliver. As much as we want to cement the working relations between civil society, government, labor, and all other stakeholders. It does not mean that working together, where there are gaps, we will keep quiet. Where there are gaps, we will speak out, because this partnership does not mean that one is going to capture the other. We remain independent. Where the good work is being done, we will applaud the government. We will applaud the officials of the government. But where there are gaps, we will speak out. And if it means that we need to go on the ground, mobilize people and picket, we will do so. But the good thing is that the minister promised us that we need to work together so that we don't have to take it to the streets. We can address these issues in boardrooms. Amongst those things, one of the things that we're putting forward is to say, if health is a fundamental human right, how do we, government, civil society, and labor, reach an agreement as to say, when the healthcare workers' unions are on strike, how do we make sure that the rights of the patients are protected? We've got good lessons of what happened in Northwest last year, Charlotte Maxeke, Temba Hospital, where some of the unions were on strike, people were taken out of the ward. So how do we amicably address these issues as a collective so that we don't end up pointing each other on our faces and fighting with each other? So as TAC, we are committed that we will work together. We will continue to speak out where problems are. We will speak out and challenge.
All right, so if all the things are done as promised and it works out as planned, could this be a game changer for healthcare in South Africa?
I think so, because at the end of the day, our call is around the implementation of the universal health coverage for all. So that's why we are saying the majority of the people, not only in South Africa, worldwide, the majority of the people are poor. And it is the duty of our governments, including the government of South Africa, to make sure that we provide quality healthcare services for the people of our country and those who live in our country. That's why also the Lancet report made mention of the decline in terms of the quality of healthcare services and the system itself. So how do we, as the users and the government and the providers, work together? One of the problems that we have in South Africa, because of the shortage of nurses or staff, most of the staff is overburdened. And in that process, they end up venting their anger to the users. As the result of that, many people, they don't feel comfortable to go to clinics because they don't want to be shouted at by angry nurses, by nurses who are overburdened. So how do we work together to make sure that our clinics are favorable for everybody?
All right, so we're going to have to leave it there, but thanks so much indeed for coming in and sharing the thoughts of the TAC on this very important NHI bill which is being debated, and let's hope that you get your wishes in going forward. Thank you so much.
Thanks for having us.